going to talk to some of the counselors here at Columbus State University in the counseling department and ask them about some of the essential basic counseling skills and what's important to them. So there's a list of skills. For example, empathy, authenticity, congruence, unconditional positive regard, honesty, support and challenge, and then the use of theories. So let's ask some of these counselors what they think about when they think of going to a counselor or what a counselor should know.
An overall kind of way, I guess I'd say empathy is probably the biggest one, because one of the things that clients are looking for, they've been living with this problem, they've been struggling with it, and they need somebody who gets it. They don't feel particularly understood, and they come in to say, does anybody understand me? And they expect a counselor to be able to say, I get it, I understand it. When I think about that from a point of view of what makes that particularly important in terms of sessions, you know, first, second, or third, I guess I would say if you can't create an environment in which they feel understood, you probably can't get to the second or third session, that you're probably going to lose the client. They may be polite, respectful, and come back 1 or 2 sessions, but emotionally they're going to be looking for somebody else to provide for them what it is that's missing because you failed to provide it. So if I'm thinking about what should happen first, empathy would be the place where I'd spend the bulk of my time. And what that really means is, for me as a counselor, is that I've got to kind of get out of my world, get out of whatever's going on in my life, and get into theirs. That sometimes takes a lot of work to do, but that's probably one of the biggest pieces of work I have to do.
Skills, I think empathy is a very powerful skill to have. Empathy is something interesting because it can't actually be taught. I think empathy is something that life gives you, the experience gives you empathy. So I think they'll have to be open to developing in their own time as they integrate knowledge of the skills.
What counselors should know and what kind of skills they should have. We're looking at basic counseling skills. So let me ask you this question. If you go to a counselor, what do you expect that counselor to do or to act like? What do you want them to do for you?
First of all, I want them to accept me as the way I am.
Okay.
Second thing, identify with my pain.
Right. So really accept you with what the story that you bring in, and also to identify with the troubles that you have?
Exactly.
Okay, what else do you think a counselor might need to have in this, say in the first session or two, what do you think should happen?
Well, I think the first thing that should happen is, number one, is for the counselor to look at my problem, okay, and look for, not necessarily give me solutions,
right,
but help me give me insight to my problem where I can find my own solutions.
Oh, okay. So you wouldn't want a counselor, for example, to come in and tell you what to do, right, or say, oh, hey, take my advice here about this, those kind of things. But you'd want them to maybe guide you or help you come to an understanding of how to pursue and how to solve your own issues.
I think counselors should establish rapport. And to begin with, any kind of situation where you're working with another individual, it's a human being relating to another human being, and in a spiritual sense, two spirits relating. And I think the whole idea is that we try to develop rapport and become attuned to each other. And for a counselor to really help someone in the clinical environment, the counselor has to develop a very high level of trust so that the client can explore her own feelings in that clinical setting. And that just comes from developing that relationship, that attunement, remembering that spiritual component where it's sort of metaphysical to discuss it from that standpoint, but I really feel strongly that we relate on that level as well.
I think it's important to help the client feel comfortable in that first session. So focus on establishing the therapeutic relationship and also creating an environment where the client feels comfortable to be able to share his or her concerns. Now, you know, this is assuming that you've already done a good job of talking about confidentiality and informed consent in general. But I think really that relational piece is critical to establish at the onset.
And what I look for in a counselor is to have face-to-face contact with me, good eye contact, to lean in and to listen, to not be distracted, to take a few notes but not too many notes, to use lots of the gestures such as and okay and I hear you. And I like for them to ask for clarification from time to time as well. That's important, just so that I'm not misleading them, or either they don't feel that they don't understand something, then we can back up and they can get the truth or get the answer that they're needing to seek in order to help me. Also, I like for them at some point, and it may not be in that first meeting, but it may be in the second and third meeting, that they begin to challenge me a little bit on my belief system, on my feelings, on my thoughts, and where those are coming from, so that they can get a different perspective from what I'm seeing.
Probably spend a little bit of time getting background on the problem, taking a look at how it impacts and who it impacts. Does it impact the individual? Does it impact the significant loved ones? What's the effect of that? How are things happening to them in their world as a result of whatever those problems are? And then sort of what the client has done to kind of think about changing any of those, and what's worked and what hasn't worked. So that's probably where I'd say the bulk of that initial work would be.
I would expect that counselor to, one, to have a sense of self where they necessarily didn't get their needs met through working with me, whereas our time was spent dealing with their insecurities or dealing with their inadequacies, but was spent more so dealing with what I came to work on as a client. I think also working with a counselor, I expect for them to have a certain professionalism, which for me means that they understand what it means to be a helper and a healer, and that they're interested in working with me to find answers rather than analyzing me as a psychologist might, or rather than just trying to connect me with resources as a social worker might. They're willing to work with me personally and developmentally to get me to a certain area of empowerment and self-actualization.
A counselor should use skills that are supportive to clients, one that makes them feel comfortable, at ease, so that they can deal with the issue or the strife in their life. But at the same time, we're not buddies and we're not friends, so that it should be something of the sort in which I am challenged in a session. Challenged to either focus on the behaviors at hand that are getting in the way of me progressing as an individual, or either challenge me to change some of those as well.
I think when a counselor works with a client, supporting them and challenging them kind of work hand in hand. Growth is a process whereby individuals learn more about themselves, learn about maybe some of the obstacles that are available for them to overcome, and in that time they might need a helper to kind of support them and challenge them to actually move beyond those obstacles and to find that more self-actualized self that they came to work on.
So folks are kind of coming in and with that expectation that you're going to tell, or you're going to direct their lives for them. And if you want them to be successful in making significant changes in their life, it's going to be because they have thought through what's going on and what needs to happen different, or they've examined some feelings about what it is that's happening, or they've taken a look at some behavior and said that needs to change. And it's all about their own work. It's really not about the work of the counselors.
I think it's really critical that counselors be authentic as they're working with clients. To me, I see authenticity being really linked to congruence. And so when you're sitting across from a client, I think it's really helpful that that client get a sense of who you are in that moment, in that relational sense.
Another skill I think is important is authenticity. In fact, I'm very big on being authentic. I think to be authentic as a counselor means that you can present a true self to clients. In a lot of ways, we act like a mirror for our clients. So if our mirror is clean, per se, or is authentic, clients can get a better read and maybe a better understanding of who they are when they work with us. And maybe the last skill would be the use of theories as an important one. I think theories are important because they guide students and guide counselors. I think theories are important because theories help a counselor work with the client and gives them an understanding of maybe what the client is dealing with, and it helps them along when they get stuck too. When you work with a theory, I guess you work with a worldview or your understanding of how clients develop problems, who you are as a helper to those clients, and what tools they really need in order to develop and grow as a person.